Hi, my name is Ray Medina. Today I'll be showing how to perform the P to A wrist, oblique wrist, and the lateral wrist on a patient. First, I'll start with shielding my patient. He will be seated, and then I'll use the right hand, so I'll use the right marker, right side. I'll start with my P to A wrist. First, I'll have him locate his wrist right here. I'll also have him curl his fingers to minimize the OID right here. The source image distance will be 40. The central ray is directly perpendicular to the mid-carpal area. Now I'll do an oblique wrist. Have him place the wrist like this. Do a 45 degrees. Do an OK sign. The source image distance will be 40. The central ray is directly perpendicular to the distal radius. And then the lateral wrist will be like this. The elbow will be flexed to 90 degrees. So the arm will rest on the ulnar surface. The source image distance will be 40, and the central ray is directly perpendicular to the wrist. So now we would be performing 3 views of the hand. It will be the P to A hand, the lateral hand, and the oblique hand. I'll use my right marker, right hand. We'll start with the P to A hand. It will be right here. The palmar surface of the hand will be placed down on the receptor. It will be at a 40 source image distance. The central ray will be directly perpendicular to the third MCP joint, centered to the film. Will be slightly spread apart. Now we'll do the oblique hand. I would have a sponge. We'll do this like this. The source image distance will be 40. The central ray will be directly perpendicular to the MCP, centered to the image. The phalanges should be parallel to the film to make the interphalangeal joints open. So it will be like this. And then we would do the lateral hand, which will be right here. The forearm in the hand is resting on the ulnar surface. The source image distance is 40 inches, and the central ray is directly perpendicular to the MCP joint. So now we would be going to the special views. One of the special views will be ulnar flexion, also called scaphoid navicular view, and the second view will be the carpal canal stretcher view. So for the first one, have our hand right here. The hand will rest in a P to A position. This. The central ray is directly perpendicular to the navicular, and the SID will be at 40. We would use a 20-degree tube tilt toward the elbow. The next view we would use this, and then we need something to stretch out the fingers. Let's try with this. This will be the carpal tunnel view. Right here. So it will be right in this position. The central ray is directed 25 to 30 degrees cephalic to enter approximately 1 inch distal to the base of the fourth metacarpal, and the SID is 40. For Every take of these x-rays, I will tell my patient there will be no instructions of respiration, so it will not be suspended, and the patient will be gowned, and for all of them, the patient will be instructed to not move.